We're going to start with video laryngoscopy, or the glide scope. Again, the glide scope has a rigid stylet, which is necessary for the angle of your glide scope to work. You place your stylet in your ET tube, and again, you will check your cuff. You'll inflate with 10 cc's of air. You'll make sure there are no leaks. And you will see that your glide scope has a screen and the power button is here. This is your camera, and this is going to help you see inside the airway. You will place a disposable plastic mechanism over the glide scope before you place the glide scope into the patient's mouth. You will hold the glide scope in your left hand, and you will place the glide scope in the patient's mouth, and you will watch the screen until you see what you need to see. So as you can see, this is the airway that we're looking for. When you see that, you want to pull out just a little bit and crank back, and then you will take your ET tube and direct it into the patient's airway. Once you see the balloon go past the cords, you will pop the stylet just a little bit and advance the tube. At this point, you may take the glide scope out the patient's mouth, and making sure that you're holding on to the patient's endotracheal tube, you will remove the stylet away from you and away from the patient. You will inflate your cuff, and then, without letting go of your ET tube, you will place the CO2 detector on the tube. You'll place the bag on the CO2 detector, and you will bag the patient. Again, you will be watching for color change in the CO2 detector, and also you will be listening to the patient's lungs to make sure that you have equal breath sounds on both sides. You will listen to both lung fields, and then you will listen over the epigastrium to make sure that you have not intubated the esophagus.